Hello and welcome to our session today. Intelligent Payer, retaining your membership is more important than ever. Thank you all for joining us. We're very excited to present to you some research that we have, and we have a very exciting panel. So my name is Lauren McKay. I'm Director of Consumer Engagement and Product Insight with Accenture. I'm going to be joined by my colleague, Tamara Clove, in a few minutes, who's going to present some of our recent Medicare research on retention and shopping. And later on, we're going to be joined by Joya Bond, Vice President of Medicare Operations from Florida Blue, and Archie Day, Director of Consumer Experience and Insight at Scan Health. We're very excited to have this great group with us today. So just to set a little context, a lot of what we're going to talk about from an Accenture perspective today is based on a couple of consumer surveys that we have done in the past year, specifically our 2020 consumer experience benchmark that was run in the first quarter of this year, and then which is a large survey with over 15,000 consumers, US adults across all spectrums of healthcare. And then in June, we ran a survey specific to COVID-19 experience, focused on people's experience with care, delivery, and their mindsets and trust types of questions. So we're going to be doing some of our research today would be based on a lot of that information. To set a little bit of context, I think we all understand we're dealing with a very different situation right now, and it's going to have impacts as we go into this year's annual enrollment cycle for Medicare Advantage. We've seen since COVID, 48% of Medicare Advantage members have had to defer or delay care. In many cases because their doctors canceled or they couldn't get appointments, but infrequently it was because of safety concerns. They're concerned about their ability to pay for healthcare, and they don't necessarily believe that they've been getting a lot of information from their payer. They have from the provider and other sources, but not necessarily from their payer. And the result of that is, frankly, an erosion of net promoter score and trust with their payers, which could have an impact as we go into this year's annual enrollment cycle. So that's some context for where we are. I'm going to turn it over to my colleague, Tamara, and she's going to walk through some of our other research associated with shopping and retention for this year.
So thank you, Lauren, and hello, everyone. As usual, there's a lot going on in the market in advance of AHIP this year. I know in prior years, some markets have had to deal with things like hurricanes, fires, other challenges that typically impacted some, but not all markets. And I think it's fair to say this year, the challenges are unusually broad and universally impactful. So you might be wondering, like, how important is retention as you think about your growth strategy for this upcoming AHIP? And, Deaf Research did a study earlier this year that suggested one of the impacts of COVID might be that switching activity might not be as widespread this upcoming AHIP. And seniors had expressed in their study some reluctance to consider making a change in coverage. But remember what Lauren just shared a couple of minutes ago regarding NPS scores. Those have taken a hit across the board. So there's this level of mistrust almost across the industry that is just a reality of the business for many, not all, but for many plans. So the question, can you afford to take your eye off the retention ball and maybe focus on some of the other strategies? And should you continue to make investments in retention programs during this AHIP and even beyond during OEP? And our own research suggests now is really not the time to pause, but you may want to rethink the approach and the focus of your retention strategies. We definitely think retention is still super important. So why? Well, first of all, it is still AHIP, and despite relatively high average retention rates across MA plans, I know specific plans experience a lot of variation in that. And the reality is that January will still be the highest growth month for most plans. The other considerations are more COVID related. So what do we know about how COVID has impacted our target market? Well, they have more time on their hands because they spend less time, 56% less time, socializing with friends and family. And they're spending more time, over 40%, watching TV and following the news. So that means they're reachable through some of those broader media channels, right? And what else are they doing more of? Well, we know they're using telehealth. Utilization of telehealth services has at least doubled this year. We know they're ordering groceries online and over-the-counter medicines online. And if this session were live, I would now ask the audience for a show of hands on how many people are familiar with the acronym BOPIS, BOPIS, which stands for Buy Online, Pick Up in Store. And utilization of BOPIS services has increased 62% just in essentially 1 month back in the March-April timeframe. So the message here is your members are online. They're using their devices, and that means they're also reachable online. And when you combine those factors, so more time and reachability, with the fact that acquisition strategies during AP are really aggressive these days. Everyone is trying to grow, and they're often doing so by putting more focus in digital spend and digital tactics. And the reality is MA plans are simply getting really smart and very effective in their acquisition strategies. So all those factors combined means your members are vulnerable to shopping and thus switching. So we do encourage plans to remain focused on retention. Now, do you need to focus equally on all members? Well, no. So which members should you focus on? Well, it's actually your newest members who are the most at risk for shopping and switching. In our consumer research, 60% of MA members who had been with their plan less than 1 year reported a willingness and intent to shop. And only 30% of members with a plan for 3 years or more respond similarly. So I encourage you to think about the interactions you have with members at each phase of the journey with your plan. And think about the number of opportunities you have in that first year and in the first few months to create a really positive experience and engage members in a positive way. That's where your retention efforts are going to have the most impact. Now, yes, you can profile all your current members to identify who's at risk. And I know a lot of plans that do that. It involves seeing who has called customer service a lot, figuring out which members are basically already mad at you and target them with outreach and engagement strategies, right? And don't get me wrong, that's still a very solid strategy. But with that approach, you've got to overcome some negative experience that a member already had with your plan. And with those depressed NPS scores that Lauren talked about, think about it, they probably didn't trust you much to begin with. So you have low trust plus a bad experience. It's really hard to get stellar results with that kind of strategy. A more effective approach would involve creating positive experiences as new members enroll and as they onboard to your plan. Don't wait for them to use their benefits or get a prescription filled. Ask yourself, what are you doing to create a consistent and positive experience for your members from the first day and the first interaction with your plan, during those early interactions with your plan and your organization? Because those are the members that's when they're most at risk and susceptible to the acquisition strategies of your competitors. So we know a few other things about MA members from our own research. We know that creating positive experiences early is very important to increasing brand loyalty and retaining members. And there are some specific experiences that we know impact an MA member's likelihood to stay. For example, enrollment materials. Members who find their materials clear and easy to understand are over 5 times more likely to stay. So ask yourself, how many calls is your organization fielding from members who thought a benefit or a process for accessing a benefit was a certain way, only to discover that's not how it actually works. And how often do members of your sales team, complain about how a certain benefit is explained in a brochure or a sales piece? You need to listen to that feedback. We also know that the hassle factor matters a lot. Members who find accessing care easy with minimal hassle are 7 times more likely to stay with your plan. And then my final, or one of my favorites is members want to be heard, respected, and responded to timely. And when they walk away from an experience with that feeling, they are 5 times more likely to stay with you. So how do you best engage and retain membership? Well, first of all, again, focus on the new members. They are the most apt to switch. And if you've been signing up agents and first-time enrollees all year long, understand those members are at risk and they know how to shop online. They may not have enrolled in your plan online, especially the initial enrollees who are new to Medicare, but don't think they aren't going to shop and potentially switch online. Focus on the early interactions. Look upstream to your sales organization, because that's often the first interaction people have with your plan. Retention is not a byproduct of just the service team and the service experience. And finally, I'll close with a recommendation based on some early insights on another piece of our research, and that is around supplemental benefits. CMS gave MA plans a lot of flexibility in the supplemental benefit space. So ask yourself this: what are you doing to ensure members are aware of those benefits and know how to access them? And which of those benefits can they access on day one as a new member before they have a significant health issue? Our research suggests a wide variation in awareness of supplemental benefits. So members generally understand they have some coverage for vision, dental, hearing. The details of that coverage, not so sure of. But the other supplemental benefits, the more creative ones that you all are starting to introduce, those benefits have very low awareness rates. However, members who use those supplemental benefits have much higher NPS scores, 48% higher, in fact. So again, think about how to leverage that fact in your retention strategies. And don't forget the hassle factor matters. So they need to understand the benefits, they need to know when they're available to them, and how to access them. So really challenge yourself and your organization to make that as easy as possible, especially for your new members, as you can. And on that note, I want to thank you for your time and for listening on this topic I'm quite passionate about. And I'm looking forward to hearing what our panelists have to share. So I'll turn it back over to my colleague, Lauren, to get that portion of our session going. Thank you.
Thanks, Tamara. Very excited to move into our panel discussion with our 2 panelists. Let them introduce themselves first. Joya Bond from Florida Blue. You want to go ahead and introduce yourself?
Yes, hello. Thank you for having me today. Very excited to participate in this panel discussion. I'm the Vice President of Medicare Operations for Florida Blue, and I am accountable for a whole lot of things, but this point today is around the member management / member retention efforts that I also manage for the organization.
Great. Thanks, Joya. Archie Day from Scan Health. Do you want to go ahead and introduce yourself, please?
Yeah, no, definitely. Thank you again. Thanks for having me, and thanks for the opportunity to discuss this. So I'm Archie. I lead the consumer experience and insights at SCAN. And part of that function, I really focus on creating insights, which could be member pain points or moments that matter to them, and really try to design experiences to address those pain points.
Great. Thank you both very much for joining us. We're very excited for this. So we're going to start off with some questions. So as you guys are thinking about this year, this coming AAP, and the impacts of COVID, what are you thinking about differently this year? And what are you doing differently? Archie, why don't we start with you?
Yeah, sure. So I think this is kind of unprecedented times. So one of the areas where we are really focusing on is how can we stand next to the member and really help them with whatever they can, what they need. So one of the big things which we are doing is really like what we call the social outreach calls. And right now we have completed close to like over 60,000 social outreach calls, where we are reaching out to our members, especially the high risk members, to really talk about what are some of the challenges they're facing and how we can help them, which could be anywhere from access to care to food or to housing or any other need. Especially we are seeing that there is a high uptick in calls related to mental and behavioral health. And so part of this is also kind of supporting those members with those resources. In addition, what we are doing is what we have called a COVID-19 tracking tool, where we really try to understand all the questions members are asking us about COVID-19, which could be out of area service, how do they access care, which could be about testing sites, which could be around, hey, I have a symptom, what should I do? Or, hey, how do I get access to my doctor? Or how do I get telehealth? And so one of the big things which we are trying to do is how can we be next to the member and kind of help them out? What I call, think of the old adage, the friend in need is a friend indeed. So that's what we're doing. And then the other thing which we're doing is the service recovery process, which is really around once we identify that there is an issue, which could be an access to member or something around the healthcare navigation, really reaching out to the member and helping them with the problems they're facing. And then the third thing which we're doing is how can we enable the provider group, especially in California, we're in a delegated network. So part of the work is how do we enable the provider group and the doctors with all the best practices, which could be around telehealth or other resources, we can help them so that they can take care of the members too. So those are kind of the three things we are really focusing on to kind of help retain the members.
Great, thanks, Archie. Joya, how about you? Same question.
Thanks. We are doing a lot of the same things that Archie just outlined, so I'm glad to hear we're in good company. Thank you, Archie. So we're calling ours bubble wrapping the members, right? So try to get our arms around them, and it's really about getting down to the individual needs of the members. We do the outbound calls. We call that because we care. We're calling them just to check in on them. How are you coping? Do you need appointments? Are you able to get all of your medications? Do you have any issues getting to see, the doctors and doing teledoc and all of that? So it's really about engaging with them on an individual level and making sure that they understand that we're here and that we're right and ready to meet their needs as best as we possibly can. But a lot of the same approaches that Archie outlined.
Great. Thanks, Joy. Let's build on a little bit with Florida. I know you guys generally rely heavily on your retail centers as a part of your AEP strategy and actually throughout the whole year. And I would imagine those are significantly impacted by what's going on right now. So how are you addressing that as for an approach this year? What are you doing differently? What's that impact look like for you?
Right. And you're right, Lauren. We do normally rely heavily on the retail centers as part of our AEP strategy. And we have 28 centers across Florida. But with COVID, obviously, we've shut them down. We've decided that even with the shields and the masks, it's just not worth the risk to the folks that would come in from the community. In addition to our members, it's not worth the risk to keep the centers open. So what we're doing is looking at how can we repurpose that? Can we do something like mobile testing on the property, outside, but on the property? So we're exploring that now and other ways that we can work with our care management team to still reach out and try to have some sort of connection with our members, but it's a bit of a challenge when you're looking at the beneficiaries and the folks in the community that aren't already Florida Blue Medicare members. So we're still exploring what other options we can implement to sort of have an impact on the community. But right now we're really focusing mostly on the testing and using the centers for that.
Thanks. And Archie, I know, obviously this new world with COVID means there's going to be substantial changes, anything that you would normally do face-to-face. How is that impacting you guys' approach at SCAN this year?
Mhm. So I think one of the areas we are focusing on is how do we deliver the same experience, but over the virtual way. And so part of it is investments in chat functionality where people can really communicate. There is kind of the concept of Zoom, of how can like the members and the brokers and the field channels can communicate, and also investments into kind of the online enrollment area so that the members can communicate and kind of do it kind of on their own. So those are some of the areas where we are really exploring and really trying to figure out how we can help out the members so that it's a little bit less like major change for them. But again, the point is that you can't just replicate the entire face-to-face experience. So it's kind of how do you deliver a similar experience but through the virtual. So those are some of the thoughts which we are kind of exploring as part of the transition.
Great, thanks.
Can I add something
Sure.
to that for Archie, just to share? We're doing that chat as well, and it works wonderfully well. The members love that. So I would encourage you in that. That's a great option to give them.
Great.
It's awesome.
Thanks, Jaya. So as Tamara discussed in the research, MA members' consumer sentiments are highly correlated to their initial experiences with a health plan. As you think about your strategies, how much focus and emphasis do you put on those initial interactions? And what are some tactics and techniques that you guys use as a part of those initial interactions to get people engaged and basically on board with you with a positive experience right out of the gate? Joy, you want to start with that one?
Sure. So we're trying to make a real effort to touch these members as early as possible. So, we all do things like welcome calls, which are sort of making their way out, but we're still engaging in those as well. But we're doing all sorts of written communication with the members, letting them know that we're here for them. We're trying to connect with them before they even get their welcome kits, because we want to welcome them into the family. We want to give them instructions on how to access their benefits, find out if they have any needs coming in that we can assist them with right off the bat. So that's pretty much where we're focusing a lot of our efforts right now, in trying to think of new and inventive ways to get in front of them, because the calls are more problematic. The connection rate, success rate tends to be low. So we're looking at, we sent out sorry we missed you cards and mailings when we couldn't connect with the members that included masks, which I think all health plans are doing now. So just looking at other ways that we can touch them as soon as possible.
Right. Archie, how about you? What are you guys doing out at SCAN around those initial engagements to get people engaged?
No, I think Joy, you kind of like really struck upon like the note on the thing. It's really about that pre-effective experience. As I always think about the member journey, like especially from a prospect to member, I feel like there's the radio silence period, what I call, between when the member like is enrolled but not effective yet, and there is that anxiety as like what's gonna happen. And so our efforts are very similar to what like Joya you were talking about. The way we have been thinking about it is how can we, like as Joy you mentioned, like how can we understand the needs of the members and help the members? In addition, we are thinking in terms of like, in addition to like startup guide kind of concept, one of the things we are thinking about is how do we set the right expectations, or how do we manage the expectations of the member or the prospect coming in. And then the other area where we are really thinking about is like, as they're coming in, what are some of the surprise or the unknown areas which they might encounter, which could be something around, okay, how do I use the benefit, or what does that mean to my current state of healthcare? And so the areas where we are really focusing on is the coordination of care, coordination of medicines, specific around building that pre-effective journey experience. So those are some of the areas where we are focusing, in addition to what Joya you were talking about, which I think are excellent things. Like I would expect my mom to go through that same experience and have that experience of like really understanding what is she getting into, and so that she is aware of it.
Great. Thanks. Tamara, you want to talk a little bit about what we're seeing more broadly in the industry around this?
Yeah, I love that term pre-effective and the whole radio silence, because when is that period the longest but during AEP, right? We have seen plans putting more focus on the onboarding process, but a lot of times that focus is still in the time period I would call post-enrollment, where I think, and so where I think there's opportunity is upstream within the sales and enrollment process as agents are having those initial interactions with prospective members. So again, onboarding is often thought of as like a service team or enrollment team responsibility. And in many cases, you have a multi-dimensional sales strategy, right? With members coming in through a variety of sources. You might have external brokers, internal captive agents, telesales, online sales. So dropping them to a common onboarding experience definitely makes sense, and gives everyone a common starting point. But you have to remember that all those other earlier interactions are part of that member's journey. And like Archie said, you got to think about what expectations are you setting during those early phases, because those are going to have a significant impact on that member's loyalty to your plan. And they bring their baggage with them when they come on. So you got to take that into consideration and do as much as you can to make sure that's a consistent, positive experience, and one where expectations are set clearly for what happens next.
Great. Thanks, Tamara. So Archie, I know you guys have done a lot of analysis on the impact of customer experience has on NPS and retention. So what insights would you like to share on how SCAN is leveraging those insights to improve the customer journey?
So part of my role and the team which we do, we actually employ a multitude of tactics which encompasses both like focus group, like a qualitative research, ethnography, plus like quantitative, where we use machine learning to really analyze a lot of the unstructured data like calls to really create the insights. So when we looked at the onboarding journey, both from a lens of like brand loyalty, like NPS and recommendation, as well as retention, what we saw was, I think what Tamara was also speaking about, was that the first year members, especially members in their first year of tenure, they are way more likely to leave the plan compared to a member who is 3 or more years. And even when we looked at that from a net promoter score perspective, net promoter score for a new member is always less than the NPS for the members with higher than 3 years. One of the interesting insights we also found, what I call is the May experience. And what it really means is that when we looked at the analysis of why people, especially the new members, didn't give a high, like was neither a promoter or a detractor, but they were passives, what we realized for them, it was kind of like a May experience, which is like, I didn't know you well enough to become a promoter of you, and neither I don't like you enough that I want to be a detractor. And so they were kind of in that good passive zone. And I think which kind of brings home the point which we were just talking about, is like, how do we build that welcoming experience, that red carpet experience, or that white glove experience, so that when they come in and they say like, you know what, that onboarding was freaking awesome. And so that's one of the biggest insight which we understood as we understood onboarding and the relationship to NPS, which kind of really helped us kind of think about building that pre-effective kind of journey on it.
Great, thanks. Joya, how do you guys leverage analytics, and how do you assess how you guys are doing and make adjustments around your consumer journey?
We actually use a lot of, what most plans use, the predictive analytics. We do various surveys. We do a lot of the things that Archie just laid out. Well, he laid it out very well. I took a couple of notes off of that, Archie. Thank you. So we go through that, and we're doing the same thing with the white glove service, making sure that we are really trying to give the members specialized service. We've done that within our member services organization. We've done it with our pharmacy partner, because those are, pharmacy is normally a big pain point for members. And interestingly, even though the national numbers are down, our numbers are up on Medicare. So I probably shouldn't say that without knocking on something. And I think that's because of the extra work that we're putting in to really get our hands around the members and let them feel that we are here and that we are going to be with them and walk them through the journey. So, and we're also looking at things like Archie mentioned about the packages that we're sending out. How do we create these how-to packages, how to access the care, how to make sure your drug is on the formulary, how to, access the supplemental benefits. So we're doing a lot of that type of work as well.
Right. Thanks, Joya. So earlier we touched a little bit on the role and importance of digital and mobile solutions as an enabler of engagement and how that's becoming more and more important, especially as agents come in and even in general, seniors are becoming more digital and mobile, and COVID has just accelerated that. So I'm going to talk a little bit about specific examples or what we're seeing in the industry in terms of solutions focused and what's working, maybe what's worked or not working in terms of digital and mobile solutions. And Tamara, why don't we start with you and what we're seeing sort of broadly in the industry, and then we'll go to Joya and Archie.
Yeah, I guess I would reiterate, much of what you just said, Lauren, that digital is only going to become more important in the Medicare space. And plans can no longer cite underutilization by this segment of the market as a reason not to invest in digital-based services, digital-based solutions. People coming into Medicare now, they're not just browsing for new shoes, right? They're buying the shoes, and they're going to keep doing that with the organizations that give them the best experience. Things like free shipping, free returns, and other perks. So their expectations for a digital-based experience are much higher, and I'm not sure across the industry anyone's really doing a crackerjack job in this space right now. There's a ton of opportunity, and certainly a lot of efforts, and but enabling members to log on and check claim status on an app on their phone, that's kind of underwhelming at this point, right? It's not going to wow them. Now, if you can give them a way to access all their supplemental benefits on day one in a cool app on their phone, and it connects with all the different vendors that you've hired to administer those supplemental benefits, and they can look up a drug on the formula, to Joya's point, or the formulary, that you got to wow them in this space. And I think there is a lot of great thinking going on in this space. I haven't seen a ton of examples of, a real wow factor at this point in time. So I'd love to hear them if they're out there.
So Joya, she's thrown down the gauntlet. We want to talk a little bit about Florida Blue and how you're approaching digital and mobile.
Yeah, that's tough. She's absolutely right. So we have an entire initiative called Digital Transformation that was recently launched because we are absolutely committed to getting into this space and figuring out how to do it well, because it is a challenge, right? And it's sort of untapped territory. So we've got a couple things going on. We have that whole initiative where we're looking at new and inventive ways to really explore and expand the touch point with the members and from a digital perspective. And then we're trying to enhance what we already have. So when we have like our member health link where they go on and they, do their assessments and access information, we're making modifications to that today where they can do, I'm going to use this example, claims, check their claim status, but they can also check their out-of-pocket costs. They can check their benefits. They can check to see if their drugs are covered on the formulary. They can do a slew of other activities. And so we're rolling that out now, fine-tuning that, looking at things like how do we connect them in the social space? because the seniors today are much more savvy, right? And that's something that will help them in COVID, but then also help us all as we move forward. So trying to connect them through other social channels where there are like-minded or people in their same age demographic or in the same situation that they're in, that they can touch point with over the internet, over their phone or through their computers. So we're looking at things like that as well, but really just trying to peel back anything we can find that would be impactful in this area. It's a tough one. So I'm hoping Archie's already discovered some things that I can take some notes from as we move forward.
Great. Yeah, Archie, you want to chime in from a scan perspective?
I say I wish, right? Like I think this is a challenge. This is an opportunity. I like the point, Tamara, you were making about like how people's expectations have changed within the very last few years, where people were more like, hey, if I'm trying to get into a new plan, let me call the health plan up. And it was intentionally a kind of complex, so it kind of like led to calling, where the behavior has completely changed to right now, where they are rather go to the health plan's website and actually look for the information by themselves, make some sort of decisions, and calling is kind of the last thing they're doing, just to kind of either kind of close the deal, like, yes, I've made the decision, or kind of like, hey, can you tell me more so that I can make the decision? So areas where SCAN we have been thinking is how can we help the prospect make a good decision about the choice of their health and their healthcare. And so a lot of the investments which we have done is around the prospect facing portion of the website, where they are able to make good decisions. There is kind of like geocode based plan finder, kind of answering some of the basic questions like, how do you find like your drugs are covered? How do you find your doctor is covered? And if you don't, like, how do you find the right doctor for you? So a lot of the work which we have been doing has been focusing on that. In addition, as I mentioned, we are spending a lot of time and energy in understanding electronic enrollment, understanding how online chat can help. And as Joya kind of really said, like a lot of our focus in the same efforts, which is like some understanding some of the needs and basically helping them how they can achieve their needs, which is part of self-service, which is part of ease, effectiveness, and meaningful, which is kind of our vision of our experience, which is how do we make it super easy? How do we make it solve their problem? And how do we make that experience meaningful so that they can remember that experience? It's kind of like the old adage, which I always say, it's not how it was, it's like how it made you feel. So we focus on that.
Great, thanks. So we've just got a couple minutes left, but I wanted to touch a little bit on the last point Tamara was making around what we're seeing in terms of the importance of supplemental benefits as an enabler of retention and how important that is as people are thinking about the shopping and retention experience. So if we just want to just quick touch, Archie, on how you guys are approaching supplemental benefits, and then Joya will let you close out.
So one of the things which we work on, the supplemental benefits, we understand is super important, like especially like dental benefits, which is different from medical benefit, but it's viewed as if it's a medical benefit. So the areas where we focus is we have this concept of teletalks, where we actually talk about the benefits with a large swath of members and kind of explain a lot of the supplemental benefits, what it means, how to access it. And then through our contact center services, we really try to help the member access those services as easily as they can.
Great. And Joya?
I like the teletalk. I made a note on that one. I'm gonna look at that. So we actually walk members through our member services department, much as Archie said, and we're also covering it in those quick touch points that I mentioned earlier. When the member enrolls, we immediately are trying to reach out to them and walk them through, because the supplemental benefits are they're often problematic, right? And they become a point of dissatisfaction with a lot of members. So we want to make sure, A, they know how to access them and how they can benefit them, and then walk them through whatever questions they may have. We're looking at putting together a flyer or a how-to access piece of communication that goes out in our Welcome Kits or as a separate mailing to kind of get them educated, because that's the big key, is getting them in quickly, making sure they understand how to access all their benefits, and supplementals are key to that. And we also are focusing now as well on how do we educate caregivers on benefits, including supplementals, because they have more and more of a presence, with our seniors as they get older. So we're incorporating that piece into a lot of the efforts that we have underway at the moment.
Right. So thank you all, and thank you to our panel for all your insights today. We really appreciate you joining us, and I'm sure all of the folks listening in will have really appreciated the feedback and the information that you gave them. Once again, if you're interested in learning more about anything you heard today, in the slides that'll be available to you, you can see there's contact information. So please feel free to reach out to myself or Tamara, or I'm sure even and Joya and Archie. I'll speak for them that they would be willing to field any questions you have as well. So thank you very much for joining. We look forward to hearing from you. Take care.